Hello everyone. Let's start the presentation now. Today's topic is the change in the quality of elderly life in the midst of COVID-19 pandemic by Jung Un Jang from LG University. Let's start the presentation now. COVID-19, which occurred in Wuhan, China, is an RNA virus with a gene size of 27 to 32 kbs belonging into SARS-CoV-2 and is a rapidly syndrome that can be infected with humans and virus animals. In March 2020, the World Health Organization defined COVID-19 as a pandemic, an infectious disease that is prevented and transmitted at a serious levels. COVID-19 is characterized as a high transfer rate, power than previous respiratory diseases such as acute respiratory syndrome SARS and Middle East respiratory syndrome MERS, which has a national social distance refrains from the unnecessary going out. Many studies investigated physiological disorders during the COVID-19 pandemic have reported that subjects exhibited multiple transmitting syndromes such as emotional distresses, depression, stress mood changes, hypersensitivity, insomnia, and attention deficit. It is obvious that infection diseases cause physiological disease in individuals, at the same time cause pain in physiological and social areas, which can eventually result in common result of poor quality of life. According to various studies, the quality of life has been a strong predictor of physiological maladjustment in the event of discharges and variable that allows in individual physiological states to be guessed. So what is the quality of life? Let's look at this quality of life. Its quality of life is an important concept that encompasses not only physical health but also physiological, socially, and mental health. Since there are various fields of dealings with quality of life, such economic, politics, social research, administration, environmental studies, and physiological, there is a tendency to interpret the quality of life in ways suitable for each field. Therefore, the definition of quality of life is various depending on the field of research. In previous studies, the definition of quality life was deep certifications obtained from quality life sort of very subjective value judges. And in another period of the studies, comprehensive ways evaluated the good and satisfactory characters of personal life. And finally, in another studies, mental health, physical health, and physical health also includes. It was defined as evaluation of response to the fans' interests in social interests, diagnosis, and treatments. Therefore, the quality of life terms is also used to interest terms of similar concepts such as well-being, and well-being of standard of life, and or satisfaction and happiness. WHO viewed health as the basic quality of life. Physical health means not just disease-free, but physical, mentally, and social healthy. And based on this definition, the WHO defined the quality of life as your perception of your purpose, expectations, norms, and interest of life. So let's look at this article, this manuscript of the AIMS. According to the survey by the U.S. Center of Disease Control Prevention, 8 out of 10 deaths from COVID-19 are aged 65 or older, with the risk of COVID-19 increasing with age and hospitalization and mortality increasing significance. Due to the COVID-19 or due to the prolonged COVID-19, the elderly with weak social resources are experiencing various social and physiological problems due to the daily change in economic difficulties. The elderly have low control of their stresses, and stress of COVID-19 can lead to exhaustion, which can affect healthcare. So it is necessary to check the quality of life elderly who are related to various infection diseases. However, many of the studies on the quality of life allergies in infections in COVID-19 situation and need for studies comparing to quality of life of the elderly before and after COVID-19 outbreak did highlighted. But its risk or lack of the many of the studies doesn't following of the before and after for the specifically for the elderly groups. Therefore, in this study, it is intended to find out about the change in the quality of life the elderly before and after COVID-19. Let's look at this study for the subject and methods. After such, we are recruiting the who want to attend these studies. So after the suspect is explained the purpose of the experiments or studies, the test method in oral and writing from the subjects who participated in the study, consent was obtained, the test was conducted. It was conducted on the elderly who could communicate by themselves, who could respond to the contact the survey. Let's look at, I just explained that one or two measurement tools. This study was used by survey of the quality of life for version of Korean. The Korean version of quality of life is there is a make in integrated four questions, social is 5 questions, spiritual is 5 questions, emotion is 5 questions, cognitive is 1 questions, and physical is 5 questions in concept all of the survey. The data analysis tests will be collected in this study were subject to the described statistics correlations analysis and regulations analysis on the general characteristics and measurement values of the subject using by SPSS 20 versions. Let's explain further or put our study for the results. First of all is general characteristics of study subjects. Of the 8 subjects, 30 were male and 58 were females, and their average age of the subject was 70 ages. 26 1 point of the questions asked whether they had alcohol or not, while the 31% asked for diseases. 11 1 point is for the high blood pressures, 13.9 for diabetes, or 13 for 19 for arthritis. 5.6 points is for respiratory diseases they had it, and 5.6 point for heart disease, and 11.1 for the other disease they have it. When asked if they were smoking, is 99% said no smoking. Or so they have when during the take the medicine have 27 and 0.3 status they have took the ordinary in medicine is for yes is 42 says is no. It's little bit changes in they have own disease or not. And when asked whether they use the smartphone, so all of the 95%, over the 95% they using their or smartphones. Only the less than in 5% they doesn't using the in smartphones. Let's look at the occupations change before and after COVID-19. We are just curious as to what is effect of the COVID-19 for the in occupation. Just look at the results. Before the COVID-19, they said they have some changes in some job have in services skills or administrators. Of course, is when we are doing the in survey, is this most of the participations they have the in homemakers in jobs, but after COVID-19, several just changes in occupation. Let's look at the homemakers. Homemakers is less than the people than just before in COVID-19 to change the after now COVID-19 its biggest changes occupations is groups. Curious that the other occupation is or just showing the increase of the changing, but is homemakers this group is loose or just high change, highest group of the change is look at this in the number of the 51 is group will be changed in the lesson is 4 is they just got this serious economic conditional. That's why they have a few of or just a lot of people thinks that they should be get some new jobs, and it's just and therefore says look at this that there is a changing is new things is farmers, and the other groups is who doesn't has any include of the groups. Let's look at the quality of life before and after COVID-19 according to the ages. Just look at this is follow groups. So first of all, let's explain to the physical factors were high from the 80 to 92 groups is will be changed is lower, and then the dose of groups is 5 to 2 and 5 to 5.2 and 5.9, which is before the COVID-19. But after COVID-19, they were found to have the decrease significantly to quality of life with the physical factors. In terms of look at the social, in social factors, the age group was highest to 70 to 79. But after the COVID-19, the age group showed the greatest decrease in quality of social factors. So let's look at the spiritual factors were found to how it changes. The spiritual factors was found to be high in the quality of life. So people in the age group will be 8 to 92, but the spirit factors felt that after COVID-19 significant decrease and the quality of life also. However, also ADL was high before the COVID-19. 70 to 79 years old groups decreased after the COVID-19, and the 80 to 92 years old age group showed the lowest quality of the life and ADL factors after COVID-19. Let's explain this our study for the conclusions. This study was conducted to find a way to improve the quality of life of the elderly by identifying the factors affecting the quality of life of the elderly in situation. Whether the elderly in the domestic community lives only at home due to the social distancing, isolation, and elderly welfare faculties. As a result of these studies, it was found that there was significant change in mental and daily life activities and abilities, and overall factors after the outbreak of COVID-19. This means that COVID-19 is the factors that change the quality of life of the elderly, and COVID-19 has also caused a change in the mental and daily life activities of the elderly. Please refer to the following for references. Thank you for your attention. Thank you.